It is frequent in the American healthcare system to hear of uncovered citizens, poor overall coverage, and high premium prices. But despite such inefficiencies, we often maintain the idea that such problems are universal. But Japan proves this wrong. Here is some insight to Japan's efficient, equitable healthcare system. Starting with data. Japan has the longest life expectancy of any country, with an average lifespan of 84.1 years. For context, the life expectancy in the US is over 5 years shorter. Further, Japan has the lowest rate of obesity globally, with 23.8% of the population overweight or obese, compared to 71% in America. Japan has developed proper means for handling patient care, with an average of over 13 hospital beds per 1,000 people. These statistics demonstrate that in terms of public health, Japan is doing something right. Pivotal legislative action leading to the present-day universal healthcare system began in 1922 with the passage of the health insurance law, based on Bismarck's German system. It mandated that health insurance is provided by firms with more than 10 employees. In 1938, the residence-based National Health Insurance Program was established and covered the self-employed, including farmers that had been previously uncovered. After World War II, the goal of complete universal coverage was incentivized by economic growth. By 1961, the final third of the population that was still uncovered gained insurance. These developments led to the present-day universal statutory health insurance system, which is comprised of more than 3,400 insurers. Citizens are mandated to enroll in a specific program based on age, employment status, and place of residence. The health expenditures of the two main insurance schemes total to approximately 11% of the GDP. The majority is publicly financed. The first of the two programs is the employees' health insurance. It is compulsory for employees at companies with more than 5 employees. The family members of the beneficiary can apply for coverage if they are dependent financially on the employed. Monthly contributions are calculated by applying a contribution rate to the salary. This amount is typically about 25%, with the employer paying half and the other half taken directly out of the paycheck. A portion of the salary is also put towards a pension plan, which is redeemable after the age of 65. The second program is the National Health Insurance, which is designed for those not covered by employees' health insurance. It also covers households. It is supported by the regular NHI premium contributions from healthy NHI members. The percentage of medical costs paid by the NHI depends on the age of the recipient. The government sets the prices, so generally it's nonprofit. The healthcare system is pretty equitable, with elder insurance allowing adults over 65 to pay only 10% out-of-pocket costs, instead of the 30% younger adults pay. This ability is due to the monthly pension payments paid throughout adulthood, but the provisions of this program may have to be adjusted in the future due to the rapidly aging population. There are also measures to assist children and disabled individuals. One of the major issues in Japan is the issue of overprescription due to the frequency of doctor visits. Further, Japanese doctors are often stretched thin due to high demand, which leads to shorter visits that may be less thorough. Here are a few questions to probe further thought. Individuals with reduced costs as well.